Well, Dr. Megan Hammel, thanks for joining us today, and I appreciate your willingness to be interviewed and talk about kids and what's going on with them and some of the challenges they're dealing with. But before we dive into that, could you give us just a little better background on what you do and how you got involved in naturopathy?
Sure. So I'm Dr. Megan Hammel. It's been really nice to meet you, Dr. Isaac, as another part of the community working with these populations. And I'm really grateful to be on the recording today. So I started out with working in conventional care, actually, like in pediatric hospitals, and just saw such a need for more holistic care providers, especially around these complex disorders. I saw a lot of really discouraged parents that just weren't getting the help that they wanted or needed outside of that conventional, medications and therapies that weren't quite bridging the gap of where they thought their child really could be. And so I just saw such a need for that. And so throughout my education, when I found naturopathic medicine, I knew I wanted to work with kids, and the philosophies of naturopathic medicine, which I'll kind of touch on in a little bit, just really aligned with my personal beliefs. And the optimization of health just feels like one of the biggest imperatives for my life's purpose. And so that kind of found me in naturopathic medicine, which really aligned. I went to Portland and I did 4 years there with specialization in pediatrics. And now I'm a board member on the Pediatric Association of Naturopathic Physicians, where we're trying to increase advocacy and, help more naturopathic doctors be prepared to treat children.
Okay, excellent. All right, well, let's dive into a few other questions here, but what are some common misconceptions that you see around pediatrics and naturopathy?
Yeah. So the first one that immediately popped into my head is that the assumption is that we are all anti-vaccine, and that is not an accurate statement. We tend to approach vaccines, and I can't speak for everyone, but for myself, from an informed consent perspective. And so weighing the risk of the vaccine versus weighing the risk of getting the illness, and really making individualized choices about that, and helping parents feel really educated and empowered in making those decisions for their families and for their children, and not in a way that's really shaming regarding any of their questions or beliefs. And so having a really open dialogue around that, and using all of the tools that we have, which includes vaccines, to really optimize people's health and prevent, major illness. And so I kind of lay somewhere right in the middle, and I really like to advocate for both. And some people are really scared to call me because they aren't vaccinated. And then I have people who are fully vaccinated who are scared to call me. And so I think just kind of opening that up to say, we are really about informed consent and about holistic health. And so it really opens the door for people to be able to have those conversations in a really safe environment, and feel really good walking away from those conversations. So that's the first misconception that comes to mind. The other one is that we don't receive adequate medical training, or we're just trained in holistic herbs and nutrition. But actually we receive a very extensive conventional medical training. So we do cadaver labs, we're taught pathology, we're taught pharmacology, on par with a lot of the DO and MD programs. And so we have that language and that understanding to collaborate and work with other providers really well, and be able to advise really well, because we have kind of a breadth of what we do and refer when appropriate.
Gotcha. Yeah, definitely having an open conversations and that informed consent of understanding both sides of the story are definitely hugely important. I agree with you on that. So yeah, great. So where's some of the more common conditions you'll see, as well as which ones do you enjoy working with the most?
Yeah, so I specialize in neurodevelopmental disorders. So that's kind of a big part of what I do, which is how we connected a little bit. So autism, ADHD, sensory processing disorder. I have a special affinity for them because oftentimes these patients, again, have struggled to find help elsewhere and kind of have hit roadblocks in terms of the treatment. And I also talk about a lot the idea of diagnostic overshadowing, where we see patients where a lot of symptoms that they're having or things that are going on are just kind of brushed under the diagnosis of autism system or the diagnosis of sensory processing rather than really being treated like an individual and addressing those issues. So I really love working with that population. The other thing I see tons of is eczema, allergies, and asthma, the kind of the atopic diseases. I have a passion for balancing the immune system and really talking about why we're seeing this shift towards atopic diseases and really how to manage that from not just a symptom picture. I also do mental health with anxiety, depression, oppositional defiant disorder. I've had bipolar, schizophrenia, GI issues. Constipation is a really common one that I'm seeing a lot in younger populations and older. And then autoimmunity and genetic disorders as well. So kind of a lot of everything, but the most I see is neurodevelopmental, atopic diseases. And then I love helping the people who need more help. And I really love having help who don't have and optimizing their health from there. So doing prevention and general wellness and nutrition is so much fun because I get to like talk about the things that keep people healthy and not just like how to, manage and kind of step back out of these disorders. It's kind of when they're doing really well that it's really fun to kind of say, how can we do better? How can we keep them really healthy?
Yeah, that population definitely usually doesn't have just one diagnosis of ADD or ADHD or on the spectrum. They also have anxiety, they have allergies, they have all these other problems. So yeah. All right. Well, great. So when you're evaluating a sensory kid or spectrum kid, what are the areas you're assessing? Since a lot of times they may already have these diagnoses, but through your unique lens, as far as how you're addressing or looking to address these kids, how are you? Which areas are you evaluating and all that?
Well, from a holistic perspective, all the areas, right? We look at the environment, we look at gut health, we look at their neurologic functioning, we check on their immune balance and genetic factors. So we kind of evaluate a lot of different areas, anything that could be contributing to the symptoms they're having. And really, in order to kind of target down to the root cause and understand that, I take a very, very, very thorough history and a timeline of events. I know I do functional testing as well, and I try to use that very judiciously and use testing where it's appropriate. But I think that history and how the child evolved and even the maternal history going into pregnancy and preconception is really, really valuable in showing some indications for certain genetic predispositions, immune imbalances that are happening even at those really early stages that I can give us more direction as to guiding, doing more advanced testing or guiding initial treatments to say, clinically, it's really looking like there might be an imbalance in this area. It might be worth it to just start addressing that or then go on to do additional diagnostic testing. But I try to be really mindful of my patients, financial investment, time investment, and really meet them where they're at as far as what they are wanting and willing to do at this point and how we can best move forward for this particular child.
Okay. So what are some, I guess the best way of putting this, what are some more common interventions for these kids based off of what you see with the results of the tests?
Yeah, so oftentimes, and this kind of goes down into like addressing the needs, but I look at removing barriers to healing. So some of these can include infections, it can include toxins, it can include environmental factors that are coming in and kind of causing irritation to the nervous system or to the immune system. So removing a lot of those and then supporting the underlying healing process and what the body actually needs from a nutritional level. Starting with that is a very like basic level, and it can sound really basic to parents, but if a child is iron deficient, that can present as ADD and ADHD. It can present in worsening of autism. It can present in like more allergic and atopic issues. And so really addressing these simple things to start off with and make sure that that baseline is set is really important and imperative because children really present a little bit differently than adults. Whereas like iron deficiency in adults really looks like fatigue and these kind of things we would expect. But in a child, we can really see these things present in different ways and different manifestations, whether that's abdominal pain can be anxiety, and anxiety can be abdominal pain, and so kind of vice versa. And so I think really evaluating the fundamentals of health, healthy diet, healthy sleep, stress and environment, and then removing those barriers through evaluation. Oftentimes with these conditions like autism, ADHD, there's always a gut issue going on. And so really evaluating whether there's overgrowth of inappropriate bacteria or pathogenic bacteria or viruses and really balancing that out does so much to help the symptom picture.
Excellent. Well, that's a great little snippet and insight into what you do, because I know there's so much more. And for people that are wanting to get more information or to reach out to you, what would be the best way for people to reach out if they have more questions and want to connect with you?
Yeah, my website is really the best place. There's a couple different ways to contact me through that. You can schedule a free 15-minute consult through the website, and that's a great way to coordinate talking to me about your child's specific issue and kind of getting an idea of an approach, and really just making sure it's a good fit for you and your family. There's the phone number there. There's email there that you guys can reach me at. The website is nd, the number 4, coloradokids.com. And that's really the best way to get hold of me.